We recently organized an ENMC workshop. So ENMC workshop are workshops that are organized every month in Amsterdam with key opinion leaders on a specific point. And there was a ENMC workshop on newborn screening. And there are several programs in Europe. Most of them, and even all of them basically, are pilot programs, so they are not yet implemented in the general newborn screening. And there are pilot programs starting in Belgium, in Germany, in Spain, in Italy. There is one that has just started in Russia, and several others that are planned. It's a general consensus now among clinicians that we should screen patients at birth to get the maximal efficacy of this innovative therapy in spinal muscular atrophy. So today, all these programs are pilot in the aim of implementing afterwards newborn screening for spinal muscular atrophy in the general newborn screening of these different countries.
Neonatal screening, everybody's talking, and we hear a lot these days, and it has been one of the major topics also the last since the new therapies that are coming on the market for spinal muscular atrophy. Neonatal screening is not newborn screening for SMA is not yet done in France. And I know other countries in Europe are doing it. In Belgium, they're doing it. Not all parts of Belgium. In Germany, they're doing it. So I know in France, people are working on it. It's not actually implemented. So I think that we have to wait a bit more to have it in France.
Okay. Nowadays, everybody is talking about the newborn screening, not just in Spain, but in the whole Europe and all over the world, because it is quite clear now that the better is to treat the patient as soon as possible. With all the new therapies that we are seeing. That's why it would be better to have the diagnosis as soon as possible in order to treat them, because that's why I think that so in Spain, actually we don't have the newborn screening in Spain is not implemented yet, but it is being thinking about, but it is not. We don't have a clear solution now to this. It is not clear what is going to be.
In Germany, we have a pilot in place in 2 counties of Germany for the newborn screening. So far, 34 patients have been identified, and patients with 2 and 3 copies are immediately treated with nusinersen. Patients with 4 copies are closely followed up. Barriers for newborn screening are too much false positive or false negative results. So therefore, the pilot should show that incidence is not going up suddenly because you have a lot of false positive results, or that you identify patients who do not have the disease. But so far, the numbers screened and the patients found are in line with the incidence. It's 1 to 7,000 people, and therefore we hope that it will be broadened throughout the whole country soon. SMN 2-copy number, of course, is done because this decides about treatment.